Today's discussion topic is infants' digest problem. So let's see. In breastfed or formula-fed babies, a physical condition that prevents normal digestion may cause vomiting. Discolored or green-tinged vomit may mean the baby has an intestinal obstruction. Consult your baby's physician immediately if your baby is vomiting frequently or forcefully or has any other signs of distress. How do you treat indigestion in babies? Lifestyle and home remedies. Feed your baby in an upright position. Also hold your baby in a sitting position for 30 minutes after feeding, if possible. Try smaller, more frequent feedings. Take time to burp your baby. Put baby to sleep on his or her back. How can I get my baby to digest breast milk? 5 ways to help with baby's digest discomfort. Nurse often babies who seem to spit up often could benefit from positioning that utilizes gravity to help keep the milk down. Adjust your feeding position, carry your baby, have some tummy time, learn infant massages. What causes stomach upset in babies? What causes stomach aches? Stomach aches are caused by eating too much or too little food, intestinal gas, or a mild viral infection. A child who has recurring stomach aches should always be examined by a doctor. Repeated stomach aches may result from colic, constipation, or urinary tract infection, that is called UTI. How do I know if my baby has gas or reflux? In fact, the burp can bring up reflux that will further irritate baby. You will see obvious spit up, arching of the body, or discomfort after feeding. But there are a few common signs of a gassy baby you can look out for: red-faced, crying, squirming post feeding, clenched fists, pulling legs up toward the tummy, passing gas. How can I relieve my baby's gas? What to do? Apply gentle pressure to your baby's belly. Burp your baby during and after feeding. Feed your baby at an angle. Try infant massages on your baby's tummy to relieve gas pressure. Check in with a lactation consultant. Keep a food journal. Wait it out. Use gas drops like simethicone. Can breastfed babies get indigestion? Reflux is less common in breastfed babies. In addition, breastfed babies with reflux have been shown to have shorter and fewer reflux episodes and less severe reflux at night than formula-fed babies. What home remedy is good for baby vomiting? For the first 24 hours or so of any illness that causes vomiting, keep your child off solid foods and encourage her to suck or drink small amounts of electrolytic solution. Ask your pediatrician which one: clear fluids such as water, sugar water, half teaspoon, 2.5 ml, sugar in 4 ounces, that means 120 ml of water. You may prepare home remedy for your baby's vomiting. How do I know when my baby's stomach is full? Your child may be full if he or she pushes food away, closes his or her mouth when food is offered, turns his or her head away from food, uses hand motions, or makes sounds to let you know he or she is full. How do you know if a baby lactose intolerant? Very important point. A bloated stomach may look slightly larger than normal and feel hard to the touch. Another sign of lactose intolerance is symptoms starting shortly after feedings. Within 30 minutes to 2 hours of consuming breast milk, milk-based formula, or solid foods containing dairy. Why is my baby gassy? Infants are usually gassy because they have immature digestive systems and swallow air during feedings. Some babies may have sensitivities that could be affected by breastfeeding, mom's diet, or a certain types of formula. Does dry water help gas? A baby is more likely to experience stomach discomfort when unable to pass gas. Some babies cry for several hours, over days, or weeks. Since the herbs in dry water theoretically help with digestion, this remedy is thought to help with colic caused by gassing or gasiness. Dry water is also used for teething, pain, and hiccups. How do I know if my baby is in pain? Crying, grunting, or breath holding. Facial expressions such as a furrowed brow, a wrinkled forehead, closed eyes, or an angry appearance. Sleep changes such as waking often or sleeping more or less than usual. Even children in severe pain may take short naps because they are so tired. What is the best gas relief for newborns? Gas drops are a medical treatment. Their cheap active ingredient is simethicone, an ingredient that breaks up gas bubbles in the stomach. This makes gas easier to pass. Examples of available gas drops for babies include little tummy gas relief drops, Fazyme, and Mylicon. But you have to take each and every drugs by proper advice your physicians or pediatrician. Okay? How do I know if my baby has reflux or milk allergy? Very important points. Babies often spit up bits of food, but vomiting beyond the typical mealtime regurgitation should be examined by a doctor. Reflux symptoms, often accompanied by signs of distress, such as back arching and restlessness, can be a symptom of cow's milk allergy. Do gas relief drops help babies poop? Over-the-counter gas drops usually contain simethicone, a medicine designed to relieve painful symptoms associated with having too much gas in the stomach and intestines. Simethicone is generally a sub medication for babies It could cause loose stools, but that is uncommon. More frequent burping can relieve your baby of gas, and high fiber foods can help with constipation. Feed your infant smaller amounts. Burp your baby more frequently. Try the bicycle maneuver. Consider using different feeding bottles. Try an OTC medication, over the counter medication. What formula is best for lactose intolerant baby? Similac sensitive. Lactose sensitivity is a milk based formula designed for babies with lactose intolerant. We also offer Similac Isomil, a soy based infant formula that is naturally lactose free. As always, be sure to discuss with your healthcare professional before making changes to your baby's diet. Okay? Again, be sure to discuss with your healthcare professional before making changes to your baby's diet. Do pacifiers cause gas? Babies soothe themselves by sucking, small enough to fit in a diaper bag, but big on. An infant has a strong sucking reflex and can be calmed when offered a pacifier. If a baby continues to cry, increased air is sucked into the stomach, which can result in painful gas and colic, leading to more crying. Why does my baby stiffen up and cry? If a baby is flexing their back up when they cry, it usually means they are feeling more than just the normal baby pains. The other reason infant back arching with or without crying can be cause for concern is that arching the back is also an early symptom of spastic cerebral palsy. SCP. Spastic cerebral palsy. Whether you offer the breast or bottle, if baby is prone to gas, then routine burping is important. Burp baby immediately after feeding. If baby doesn't like the traditional over the shoulder burping position, try laying them face down over your lap and patting their back. So that's all about infant's digest problem. If you have any question, you may keep it down of my videos. I will give you answer and proper counseling. Thank you very much. See you again. Bye. The end. Thank you.